I am Tracy Murphy. This is Christine Trester.
Hello.
We are co-owners of North Shore Audiology Consultants in Highland Park. We run a medical-based audiology practice, which is focused on treating hearing loss as a medical condition. We do the full range of diagnostic audiology evaluations. We do also fit hearing aids as medically necessary, as opposed to some practices that are solely based on selling hearing aids alone. And that together we have about 45 years of experience clinically, and we're going to try and help you learn a little bit about navigating some of the ads and things that you get in the mail and probably are inundated with. I'm curious if people want to just kind of go on camera. We want to try and make parts of this interactive if we can. So if people want to activate their camera, I'm curious to take a little poll.
Via show of hands.
Via show of hands, you know, just raising your hand in the screen. If you guys don't want to go on, we don't have to do that, but I am kind of curious how many people wear hearing aids, whether anybody is a member of a Medicare Advantage health plan, and so on.
People can message the chat too if they'd like, and I'll let you know.
I see Stephen raising his hand. Thanks, Stephen. Stephen, are you raising your hand to hearing aids or Advantage plan or both? And you're on mute, so you might want to just unmute.
Yeah, I think I misunderstood. Okay, I think I misunderstood. I misunderstood the question. I don't wear hearing aids, but I misunderstood the Medicare Advantage thing. I'm on Medicare, but not Medicare Advantage.
Okay, great. Right. I think somebody else might have had their hand up too, but you can share if you want. Just curious. I would say when we get to the second half of the presentation, if people do want to go on camera, we might try to be a little more interactive. But I'm going to go ahead and share our screen, and we're going to start our presentation formally and get this show started. Give me 1 second. It's over here. I just have to make it bigger. Hang on, guys. Technical issue. Nope. Give me 1 second. All right. So I am curious if you guys can all see our screen now.
Yes.
You should be able to. And I'm going to try and move this off the way. And we're going to jump right in. So the disclaimer that I want to start with is that if any of you have worked with an audiologist or hearing healthcare provider in the past, there is some degree of subjectivity to products they like to work with or are more knowledgeable about. There are many different hearing aid manufacturers, and providers can't work with all of them because it's too much to stay up on. I will say that we work with all the major manufacturers here. And then there are a whole range of hearing healthcare providers besides audiologists, who might include hearing aid dispensers or hearing aid dealers, who are more of a basic entry point. They have, I think, a 2-year education and are really trained in how to sell a product, not so much the medical aspects of hearing loss and so on. So you're going to get certainly our biases in what we see clinically with patients in our daily practice. So I'm not sure if everybody knows this, but Medicare does not cover hearing aids. Hearing aids are statutorily excluded from the Medicare statute, and I can speculate on many reasons why that may be. One of the more obvious is that on Medicare's inception, audiology was a very new profession. So I think that not much was known about it, and they just weren't included. Part of it was also based on audiologist classification within Medicare, where Medicare has us classified as diagnosticians only and not as treatment providers. So that is also part of why Medicare does not cover hearing aids, because they are a treatment option. So I want to talk a little bit about third-party payers. So Medicare, an alternative to Medicare is a Medicare Advantage plan, which is a replacement plan that all Medicare beneficiaries have the option of signing up for when they sign up for Medicare. And the rule with Medicare Advantage plans is that they have to, at a minimum, provide coverage for services that Medicare covers. Many times, those Advantage plans will also include coverage for services or items beyond what Medicare covers. And what we're going to talk about today is specific to hearing aids, but those services typically can include hearing aids, hearing, dental, and vision services. Most often, and I think it's now 100% of the time, those Medicare Advantage plans contract with what is called a third-party payer, or a TPA, to help administer the hearing healthcare aspects of their plan. In the 1990s, when this trend first started, those third-party administrators were really there to help with managed care, and they provided more administrative support. And now it has evolved to the point where those TPAs are designing the benefit, they're forming specific provider networks that may or may not include all Medicare providers. They are also involved in the management and processing of the benefit claims. So they're involved in a lot more than they used to be, and they actually are formulating how those plans work. So back in September 2024, Medicare enrollment was about 68 million people, and that was just over half of Medicare-aged individuals who are involved in Advantage plans. So slightly more in Advantage plans than those in Medicare alone, with or without a supplement. That trend is expected to increase as years progress. So what's important to understand, because the TPAs that are associated with the Advantage plans for hearing aid benefits will advertise benefits significantly. And I think a lot of times those supplemental benefits are what sway members to join an Advantage plan over standard Medicare. And when it comes to hearing aid services, it's important to know that most of the TPAs that provide those services or design those benefits are either owned, contracted, or affiliated with a specific hearing aid manufacturer. And as such, and I've listed some of them here on the left-hand side, you'll see some of the TPAs. And I would think that some of you have heard of them. True Hearing is a big one. United Healthcare Hearing is another big one in this area. And next to it, I've listed the major manufacturer who owns them. And what's important to understand in that, we'll get into it in more detail, is that typically the products that are made and manufactured by the owner are the ones that are prioritized in that plan. The other thing that's important to realize, and I think it can sometimes be misleading to people, and I'll single out United Healthcare Hearing. If anyone's heard of the health insurance company United Healthcare Hearing you would think would be part of United Healthcare Insurance Company, and it is not. It is a hearing aid company. And so it's a little misleading that people think that United Healthcare is providing their hearing aids, but instead they are steering patients to United Healthcare Hearing, which is its own company that has its own proprietary product that they do incentivize through their providers. So the advantages of having benefits through a third-party administrator through these Advantage plans is that those plans will often have a large referral network that they can refer patients to, and they may have lower cost to patients. And one of the things we're going to get into when I move on to the next screen, which is the disadvantages, is whether or not that lower cost is really a savings or not. And so we'll go through these one by one. One of the biggest disadvantages, in our opinion, and we are all about in our practice what will work best for the patient and patients having choice of providers and products. Medicare, not all Advantage plans are open to providers who are enrolled in Medicare. So most of them, as a matter of fact, have their own provider network that is largely constituted of hearing aid dealers. And should you decide to go through those benefits with that plan, you are required to see a specific provider. So if you currently work with an audiologist, you may be required to go to a different provider should you want to proceed with the benefit. In this area, if we have any retired teachers on, the state of Illinois is one exception to that. Their state of Illinois retiree program does use a Medicare Advantage plan through Aetna, but the way they've built that benefit is that beneficiaries can see any Medicare provider as long as they are a Medicare provider. And we feel strongly that every Medicare Advantage plan should be structured that way to allow access to care and choice of provider. Many of the plans, because they will prioritize hearing aid dealers, they're not recognizing the difference in expertise of audiologists or the advanced training and education of audiologists. Don't know if anyone on this call realizes that audiologists are doctoral level professionals. So training is 4 years post-graduation from college. So a very rigorous standard for care and a very high standard for care. And there have been issues with a lot of the TPAs with finding providers in certain areas. So limited choice of provider is a big one. The second biggest, or maybe even, I don't know how to rank them, so they're all not ideal. Many of them aren't clear about benefits, and they will have advertisements that talk about hearing aid benefits or hearing aids are covered. And we see a lot of beneficiaries who go in for services, and many of the so-called benefits that are offered through their plan are discounts, and they're not a fully funded benefit where the patient isn't paying anything out of pocket. Or if they have no cost out of pocket, it is for a very specific product. And again, it would be one that they're incentivizing because it's a product they make. So we will have patients come in and they will go someplace for hearing aids thinking they have a benefit, only to find out that they're still having to pay significant portions out of pocket. Most of them, as I've said multiple times already, will limit access to either brands of technology or different tiers of technology. So hearing aids can be very basic, and think of them as computers. So they automatically adjust based on the environment around you. There are different tiers of technology where the more advanced the technology tier is, the more automatically that hearing aid adjusts for the environment and changes what it's doing to help you hear well. And it also changes how many parameters providers have to change to make that hearing aid work better for you. There are some plans that will limit access to the lowest tier of technology. So that's important to know. It's also important to know that the contracts that those TPAs have with providers cover very specific services. And because most of them underrate the professional services that are provided by audiologists and hearing aid dealers, patients will be charged for any service out of pocket that isn't written into that contract, because providers, in order to stay in business, need to be able to bill for everything that they do. So those are things that aren't always disclosed up front and are important to know. Some other problematic issues with TPAs is that some will even prevent the provider from discussing technology with patients if it isn't covered in their plan. And that's a huge ethical concern for us as providers. You know, our goal at the end of the day is to fit patients with technology that's going to be the best for their needs, not something that's going to sit in a drawer or not help them. And so we will choose not to work with TPAs because of a lot of the issues on this list. One of the other issues that that is problematic is that hearing aids are dispensed with a trial period. Wearing hearing aids is not like wearing glasses. So it's not like you get a hearing aid, you put it on, and we say, okay, we'll see you next year. People aren't used to hearing when they get hearing aids. So there's a period of time that's needed for acclimation. And then there's a period of time where we need to be able to adjust those hearing aids for people's individual preferences for hearing. Hearing is very subjective. I could bet that Christy and I even like to hear differently. And so that can take weeks of time. And a lot of these TPAs, if a patient starts out with a provider and goes through 1 to 2 months of appointments with providers and they don't keep their hearing aids, those providers are not reimbursed anything for the professional time they spent with patients. And so I beg any of you to tell me what medical professional you see where you're not charged something for an office visit over time. So those are some of the disadvantages and the large reasons why we choose to not partner with TPAs, because we don't feel they're in the best interests of patients based on lack of transparency more than anything. It's hard enough to navigate the world of hearing aids today without knowing half of this stuff. And that's not even talking about technology. So TPA provider or not, we recognize that patients need access to hearing healthcare, and that not only audiologists, but all hearing healthcare providers deserve to be appropriately paid for services. And both groups need to feel like their needs are being met. So if you have an Advantage plan that has services or benefits through a TPA, you know, you have a lot of options that you can pursue. One is use the TPA benefit as it's written. So you'll go where they recommend you go, you'll get the technology that they dictate, and pay out of pocket for whatever isn't covered. Just know that if you use the benefit that way, that there is a trial period, and advocate for yourself. Don't keep a hearing aid that isn't meeting your needs or improving your ability to function significantly. Another option would be to purchase the hearing aids through the TPA. And if you find a provider who's willing to service them and program them, you can pay out of pocket for professional services for another provider. Or the last option is practices like ours. We've worked with our manufacturers to offer competitive plans for products that we feel, first of all, we have a full range of products, and we feel they're better than most that are offered through those TPA plans. So those are options you can pursue as you go through the process if you have a TPA benefit. I want to stop right now, and I'm wondering if we should entertain just a few questions. If there are any questions so far, Nathan, I think we can maybe answer them as far as Advantage plans, because we're going to switch gears in a second.
Yeah, it looks like Marver raised their hand. Marver, I don't know if you want to message the chat for your question or go unmute yourself and feel free to ask the question.
I wanted to know what a TPA is. I never heard of it.
Yeah, so a TPA is an abbreviation for third party administrator, and that is a agency that is tasked with creating and processing administrative claims and all of that for hearing aid benefits associated with Medicare Advantage plans. So if you've heard of things like True Hearing or United Healthcare Hearing or Nations Hearing or Amplifon, those are all TPAs. And so they are a specific group that is administering a hearing aid benefit for a Medicare Advantage plan. And if you weren't on at the beginning when we went over that, they are typically owned, affiliated, or contracted with a specific hearing aid manufacturer. So the benefits of those plans are typically favoring that manufacturer's products.
Okay, thank you.
You're welcome. Anna, did you have a question or no?
I think that appears to be it for now.
Okay, perfect. Then we'll go back to screen sharing and we will carry on. Move this out of the way.
So we're shifting gears a little bit because while we have found a lot of the patient population that comes through our practice has been inundated with a lot of information about Medicare Advantage plans, I think everyone here can admit to receiving marketing related to hearing aids, over-the-counter devices, and anything of the sort, probably in a healthy margin. So what we thought might be interesting is to take a couple of those ads and first kind of task the group to maybe identify some things on those ads that could potentially be problematic. So we're going to go to the first one here, and maybe some of you have seen this ad before, the famous Joe Namath recommending a set of hearing aids for as low as $297. What a miracle. Has anybody seen this before?
Yes.
Yeah. Can anyone, in looking at this, especially if you're looking at it for the first time, maybe see something that could be a little bit questionable about it? Okay. I'm going to run through, some different things. First I can point out, this, the price of hearing aids is never going to be this low. The simple fact that the technology that can be as good as a standard set of actual hearing aids, there is inherently going to be a very big difference for what someone is paying for. When you see something that has a cost as low as a couple $100 or even lower than that, these devices truly are amplifiers. They're, in essence, taking sounds, all sounds, soft, loud, no matter the pitch, and raising them all the same. They come with a non-standardized fit. And I think the fit is, so aside from hearing, which Tracy and I could massively perseverate on, something that we both really like to explain is that fit of devices in someone's ear, the complexity of getting the right fit and the importance of getting appropriate fit is so foundationally important that they're, even as seasoned audiologists, the fit is one of the more complex things that we are looking to achieve with every single person that we work with. There really is a never one size fits all.
And I'm going to jump in on that too, specific to this ad. If you can see the picture in the box where it looks like a plug in the ear, to Christy's point, we're not just talking fit so that it fits in the ear and stays in the ear, but whether that tip or the hearing aid itself plugs the ear completely or not changes how that hearing aid works acoustically. And for somebody, for example, who has normal hearing in the low pitches, a hearing aid like the one in this ad would take away the hearing in the low frequencies and the low pitches where it's normal. And it would also trap those low pitches in that person's head. So when they talk, they would feel like they're talking with their fingers in their ears, and everything in their head would echo and be over amplified. It would not be satisfactory. So that's an example of what we mean by the complexity of fit. So it's just not as easy as popping something in your ear.
Mm-hmm. Another point I can make here is where, if you can see where it says 45-day risk-free trial. Again, as Tracy, I think, noted, the state of Illinois requires a trial period. That isn't something that's unique to any of these less expensive over-the-counter devices. And hearing aids are always refundable. I will also question, specifically, I think it says that this product is supported by U.S. audiologists. I will argue that as completely false. But we can continue to nitpick. I'm going to show another one here. Thank you. That I'll give you a second to kind of read this because it may not be. It did, but they're pretty similar, okay. Trace. I think it's okay. Ultimately, what I wanted to point, or what we wanted to point out here, there's a whole bolded point here that says to schedule a free hearing screening, and I'll argue that a hearing screening isn't ever really going to be helpful in determining a whole lot of anything. That a full diagnostic evaluation needs to be completed to be in the best interest for anyone who is pursuing hearing aids. And I'm not quite sure the purpose of putting this comment about earwax or other blockages, because hearing often is not grossly impacted by the presence of wax in the ears. But that, again, is something that as professionals, we are taking care of that in the office. I would always be wary that if you see something that has a set of just a few days and hurry up, you better call, or we're only accepting, 10 people, we would argue that that's not really necessarily a place that you want to be. A provider should be available at any time that works in your capacity. I want to kind of shift to a hot topic in the world of marketing and hearing aids. So down at the bottom of this ad, you can see, if you can't, I'll read it. It says, trouble hearing spoken conversation is associated with up to 91% increased risk of dementia. How many people have heard about the association of hearing loss and dementia? Anybody?
Yep.
Yeah. We would venture to think yes, that there has been a lot of press about that. We wanted to really clarify that while there has been a causal relationship with untreated hearing loss and cognitive decline, we want to point out that hearing loss is one of the most modifiable risk factors for hearing loss. For that decrease in cognition. And ultimately, there are a lot of non-modifiable risk factors that are likely going to play a much larger role as to whether or not someone is going to have an onset of dementia or something of the sort. Did you want to expand on that?
Nope, I agree with you.
So the whole theory behind and the evidence behind this is that ultimately, the less accurately that somebody is hearing, the more cognitive load. What that means is the harder your brain is working to try and compensate for what the ears aren't hearing normally. You're trying to figure out the context of what's being said because you're not getting all of those sounds clearly. And that lack of appropriate stimulation is what ultimately can accelerate that atrophy of the brain. And it can also lead to an increase in social isolation. A lot of times people start to avoid situations. Some of you may feel this way because, gosh, it's just so exhausting when I go there, or, you know what, I'm not going to hear anyways. Why would I go? And the more isolated that somebody becomes, the more these factors come into play.
And social isolation and social, let me rephrase that, meaningful relationships are probably the largest important factor in healthy aging. And when people do socially isolate, they lose those meaningful relationships and interactions. So from a healthy aging standpoint, that's one of the largest reasons why untreated hearing loss can be a significant issue for people as they age.
Mm-hmm. So, just to kind of continue with this, again, there's a lot to read here, so we don't necessarily expect you to read through all of this, but there was a point, I'm not sure if everyone can see my arrow, but again, a free evaluation and a free video otoscope inspection. There are a lot of gimmicks that you probably have either caught or maybe are unaware of, but our job, we feel, is to help kind of point some of these things out. These are not anything that is special or unique to a basic diagnostic exam, that really, again, basic to the core of giving someone an appropriate evaluation. Miracle Ear, I'm sure most of you here have heard about Miracle Ear. It is a proprietary hearing aid company. So what that means is, let's say one of you, all of you, decided to go to Miracle Ear to get hearing aids, and man, that person there just could not really get them programmed in a way that you were happy with, but you were outside of your trial period, you couldn't do a whole lot about it, and you thought, I remember listening to that talk from Tracy and Christy, and I'm going to call and see if they can maybe give a second look at these hearing aids and reprogram them for me. And unfortunately, we can't, because they have proprietary fitting software, much like Costco utilizes proprietary fitting software. You are locked in to those providers, different from, again, the major hearing aid manufacturers, legitimate hearing aid manufacturers who are utilizing massive international research and development to have products that are accessible from any audiologist that is working, in a standard setting, non-proprietary setting, can, look at those, reprogram them, service them for you. So, we see a lot of patients in our community who end up in this sticky situation where you've spent sometimes, in many cases, a lot of money, and you can't end up getting the service that you deserve.
And just as a point, we could dispense Miracle Ear hearing aids in this practice, but Miracle Ear would stipulate that that's the only technology we dispense. And we do not believe that there's one hearing aid manufacturer algorithm that fits all hearing losses the same. And we believe very much in choice. So,
yeah. Anything else to add there?
No, not on Miracle Ear, unless you want to talk about Kelly.
This is being nitpicky, but again, these are things that we can give you these tools to kind of sift through as you're bombarded. So the about the expert at the bottom, Tracy kind of touched on this, but this individual is a hearing instrument specialist that is basically in line with a hearing aid dispenser, not an audiologist. This person basically passed a test post graduation from high school to be able to do the same thing that we as doctoral professionals that spent 4 years doing psychoacoustics and many other diagnostic and types of classes to fully understand the ins and outs of what's happening with the auditory system and with the complexity of technology. So, it's an unfortunate reality in the world of audiology that those types of providers are allowed to do many of the same things that we do, but Tracy and I will take to our deathbed that hearing aids are only as good as the person who programmed them. So we could have, you could, and we see this, somebody could have the best of the best technology that is available to them. And if those hearing aids aren't programmed well, you're dead in the water.
Right. And Kelly is also a brain health specialist, which is she specializes in brain health, which again, I would question, what you see in marketing ads. And to Christy's point, your success is contingent on who's programming it, as well as to some degree the technology. Because if you have a real basic level technology, and let's say you did come to our office, if there's not as much that we can change with it, we can only make it sound so good. So those are factors.
Yep.
As well.
You
can talk about it.
So this is another hot topic, and I would say not even just unique, obviously, to hearing and hearing aids, but since that's what this talk is about, that's what we're focusing on. You'll probably, if you haven't already, definitely start to see a lot of information advertisements about devices that are utilizing AI and that, oh, this is something special. But the reality is that all major hearing aids are utilizing AI, or I will argue that pretty much any electronic device is pretty much using AI in some capacity. That's a very blanket term. And to really break apart the ins and outs and the how and the why, that would be a whole nother talk in and of itself. But the reality is, if you see that, don't get sucked into it, because all devices are doing that in some capacity. And if we come back to, as Tracy has brought up more than once, the fact that even with legitimate hearing aid manufacturers, there are different levels of technology, and the AI capacity changes substantially between those different levels.
And a couple of the major manufacturers actually will use AI in their marketing. And I'm going to tell you it works, because the number of patients who call in and say, oh, I read about this deep neural network and it uses AI. And I don't blame people for calling, because you don't necessarily know any different. But that deep neural network is really just that manufacturer's proprietary algorithm, and all the AI that's being used in hearing aids now. And as Christy said, every manufacturer is using it to some capacity. It's not open learning. It is all programmed into it. So it's a set AI, and it's just not all it's cracked up to be in terms of how they're using it in marketing. So we just want you to be well informed, so that when you get the ads, just be cautious in what you believe and what you get sucked in by. So in summary, we want you to be able to interpret hearing aid ads and offers with caution, and in a way that allows you to recognize gimmicks that are meant to get people in the office,
or incentives.
Or incentives, right? Mm-hmm. Yeah, there's a place not far from us around Thanksgiving. I think they used to give turkeys away just to get you in the office. Know who you're working with. Again, I don't want to, just keep beating a point, but it does matter. The caliber of the professional you're working with and the standards they hold their treatment to. Understand that not all hearing aids are created equally. And at the end of the day, it's up to you to decide what drives your healthcare decisions. We see people on a daily basis. If people are motivated solely by cost, that's totally fine. And there are places that they can go to get inexpensive hearing aids. And there are people who, no matter what, they want the best of the best. Long and the short of it is that you, not to be cliche, but you do get what you pay for. Mm-hmm. So just keep that in mind. And as you make these decisions, if you go one route and you don't have good success, don't necessarily get down on the technology or the prospect for help, because there are a lot of options and a lot of different providers who may treat it differently. Let me go ahead and stop this, and we can entertain some questions now.